So now we're coming to theories of how we actually age well. So calorie restriction has been around for a long time. And so this is a famous picture of two velvet monkeys. The monkey on your right, on the screen's right, on that side, your right, has had free calories and able to eat as much as he wanted to. This monkey has been kept on 30% of the average requirement for a monkey. And this monkey is much healthier, has free of cardiovascular disease, but if you have a look at the haunted look on the monkey's face, he's not a happy monkey. So while calorie restriction does make a difference, and we actually understand the mechanism whereby calorie restriction makes you live longer, it's not really practical. And so we know the theory behind that is that there's something called mTOR signaling, which is a genetic DNA sequence which conserves the energy. Basically, it slows down the metabolic rate of the cell. And so if you take a yeast worm and you measure and you inhibit mTOR by an enzyme, basically the yeast worm lives longer because it signals in response to dietary restriction the cell to take steps to conserve energy. And at least in a fruit fly, you have to a fruit worm, yeast worm flies, I beg your pardon. You have to reduce it by 20. You have to reduce the calorie intake by 25%. By stressing the body recognizes, at least, and probably in humans, but certainly in animals, and certainly in insects, and in mice as well. The mTOR signaling cytokine is the mechanism whereby this calorie restriction works. So obviously, now that you've identified one of the steps whereby calorie restriction works, is it possible to inhibit the mTOR cytokine in ways other than starving yourself? Well, there's tons of candidates along this, and the two that are best known, one is called Rapamycin and the other one is called Reversetrol, and these are those are drugs which have the reputation and at least in animal models, to actually inhibit the mTOR cytokine to do that. And if you go online and you Google it, you will find many people wanting to sell you Rapamycin and Reversetrol offline, off-label. Unfortunately, I'd advise you not to get involved in that, because while it might work for fruit flies and it might work for rats, it hasn't been tried in humans. So Rapamycin extended the expected lifespan in middle-aged mice by 28% to 38%, and again would inhibit it. And the reason I put Rapamycin, I put a picture of the statues on the Easter Island, is because suitably exotic Rapamycin is a yeast only found on Easter Island. So Resveratrol is the red wine. And that's one of the reasons why red wine is reputed to be good for you. Resveratrol mimics several of the biochemical effects of calorie restriction. Again, resveratrol extends the lifespan of fruit flies, nematode worms, and short-lived fish, and is found in red wine. But realistically, you'd have to have something like 30 or 40 bottles of red wine a day to get sufficient amounts of resveratrol. So while people might try, I suspect it won't be very effective. So what about taking resveratrol as a supplement? And that's available. Unfortunately, that doesn't work. It hasn't worked in studies so far. So we're still in the early phases of understanding. We've come a long way in understanding how senescence occurs, how we age. We are getting some clues about how this process can be manipulated. The problem so far is we haven't been able to translate that knowledge into therapies that are useful in human beings, useful and or safe and or useful. So we, as of the 30th of May 2012, we are left with, we have what we have, and every day all of us get older. How can each of us take control of our future and live? How can each of us live successful aging? How can we? What things can we do to age successfully? And basically, in the last 24, 25 years that I've been doing geriatrics, I've seen people who are healthy at 90, but with disability, and they're people who look pretty good on paper, but are total, wrecks at 65. What's the secret? And so there are four components, and we'll talk about them each in turn. The first one would be risk modification. In other words, the things that we all know about. So would be controlling your blood pressure, having an ideal body weight, would be if we have elevated cholesterol and other risk factors, to take steps to deal with it, not to smoke, to avoid high risk activities, and to have a prudent lifestyle. The second component is luck, because I'm afraid if you're 80 or 82 and you're going to get some terrible disease, I'm afraid you're out of luck, because you just have chosen the short end of the straw. So clearly a big component of successful aging is luck. And so when you see people, when they turn 100 or some milestone, and they get asked, what's your secret to successful aging? And they say stuff like, well, I just rub a clove of garlic on my head every day or whatever. And basically what it means is people have been colossally lucky, and they've never had to confront a challenge. They've dodged all the bullets, and it's wonderful, and it's terrific. But the really admirable people are the people who are able to deal with adversity. Those are the people who really deserve our respect. Because they are really, it's one thing to not have challenges. It's a completely another thing to have challenges and overcome them. The third component, which may or may not be treatable or do anything about, is your personality. What type of personality do we have? Are we indecisive, know-it-all, agreeable, a complainer, silent, aggressive, or negativist? And so, that's really what we're born with, which I suppose might be luck or whatever. But it's personality has such a tremendous outlook in how you deal with adversity. Can you teach an old dog new tricks? Is it possible to learn to do new things? So often I see people who clearly aren't doing well, and they're living at home, and they're falling, and they're losing weight, and it's clear that there's a problem at home. And you say to them, well, and they've got real reason for all their problems because of physical limitation. And you say to them, you're not managing, you've got all these problems, let's put in a homemaker. And they say, no, I can't have anybody in my house. And I say, well, this person would come and you'd get to know them and they're bonded and blah, blah, blah. No, I can't have anybody in my house. I just couldn't. You say, well, I understand that, but you realize if you continue doing the same old, what you've been doing has been failing. If you continue to do that, if you continue along this path, you're going to land up in a nursing home and you're going to lose all your independence. And somehow they can't connect the dots. And what I tell people that sometimes by accepting help, you retain your independence. Some people can accept that and some people can't. Because initially when you say that, it seems like a contradiction in terms. If you accept help, you retain your independence. By accepting help with small things, but the big things remain independent. The people who are able to accept that and operationalize it tend to do much better. What determines that ability to do that, I'm not sure. Probably personality. An example of that is hearing. So I'm pretty sure that I'm getting to be of an age when I'm losing my hearing, and if we had an audiology lab testing in this outside and everybody signed up, I'm pretty sure 95% of this audience would have sensorineural hearing loss of high frequency. And so inevitably, your children would say, Mom or Dad, you're getting deaf. And you'll say, speak up, I can't hear you. Or you'd have to say, could you say it again? And then they'll say, well, get a hearing aid. And they say, well, I don't want a hearing aid, I'm just going to wait. If you just spoke louder, I wouldn't. Or I can hear the news fine, so why do I need a hearing aid? Or as long as there's no background noise, I can hear. And I'm not going to have a hearing aid because blah, 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 blah. That's very common. And then eventually what happens when people get to be 80 or 85, eventually you give in to people who nagging you, whatever, or you decide maybe it's time to get it. And guess what? You spend $1,000 or $1,500, you get a bright new hearing aid, you put it in your ear, and then it whistles, and it irritates, and it's uncomfortable, and the battery goes flat, and then you drop the battery, and you can't fiddle around. And then after 3 weeks, you get fed up and you put it in the bedside table, and it spends its life in a bedside table. And so what I've learned is that you see people who use hearing aids, and they use them all the time, even in noisy environments. And you say, when did you start using a hearing aid? And say, I started using it in my 40s and 50s and 60s. Because it turns out learning to use a hearing aid is very hard work. You have to have an adaptable brain which has to exclude background noise. And you have to learn to concentrate and lip read. And it's hard work. Plus you have to have the physical dexterity to actually manipulate the stupid thing. And so if you're much more likely to be able to use it if you start getting adapted to it. So I always tell people, use a hearing aid earlier rather than later, because only good things are going to happen. Similarly with the cane, when your gait is starting to be a problem, and you're not walking as fast, and you're restricting your activities because, clearly because of balance or because of pain, you're much better off using a cane or a walker and walking further and faster with more confidence than sort of walking short distances with lack of confidence. That's an example of taking an aid to using your independence, to maintain your independence. Those are two examples which I use. Easy to say and hard to do. I realize people don't. There's a stigma attached to having a hearing aid, and there's a stigma attached to a cane. But the people who are able to recognize that and suck it up and do it tend to do better. And that's probably the second most important message that I have today is to adapt as much as possible, rather than try and fight it. And people say, oh, well, this person is fiercely independent. Fiercely independent is good, but good in one sense, but terrible in another sense if it precludes making any adaptations. So this is a terrific example that I saw at the Falls Clinic. This is an 88-year-old gentleman seen in the Falls Clinic who had a fall, which actually resulted in a fracture of his L1. He was a World War II vet, and he had severe sensorineural hearing loss. He was in artillery and from the noise exposure. He had a grossly unstable right knee. He had adrenal insufficiency, so he was on long-term cortisone. He had terrible back pain from spinal stenosis. Had back surgery ×2 with terrible back pain. He had a big heart attack, which left his heart with a big ventricular aneurysm, and poor balance and walker dependent. And you think, oh my goodness, you look at this man with a big heart that's likely to pop and spinal stenosis, who's deaf, who's got an unstable knee and his back pain, who's just fallen. And yet this man was just, he was adaptable, he was optimistic, he had restricted his activities. I said, are you depressed? He said, no, should I be depressed? He was tough. So whatever he had, we should bottle it. Because it's really magic and it's really inspiring. Despite all the disability and all the challenges that he had, he was completely functional. So it really goes to show you it's not what you have, but how you deal with the disability that makes the difference. So the final thing, we can't control luck. We can have a healthy lifestyle, and most of us do. We can't control luck. We can try to be adaptable, to our lifestyle. I mean, we try to be adaptable and try to accept help and work with the constraints of our personality and recognize that. One thing we all can do is an effective exercise program. You can take a horse to water, but you can't make him exercise. You can ask people to exercise and facilitate it, but people who don't want to exercise won't. And there's always a reason why you won't exercise, and there's always a good reason why you won't exercise. But somehow the people who want to exercise do. And when you talk about exercise, it doesn't mean that you have to do the exercise that you were doing 30 and 40, 50 years ago. It's what you can do to learn to live within the disability. And so that's really the most important mechanism. One little caveat with that is people overestimate the exercise that they do. I'm always active. I don't need to exercise because I'm always active. I look after the house. I'm up and down the stairs all the day. I'm up and down the steps all day, the flight of stairs in my house. Or I'm on my feet all day. I never sit down. That's true, and it's certainly true, but that's not actually exercise. Exercise is exercise for exercise sake. And people way overestimate how much exercise they do. People say gardening is exercise. Well, not really. It might be terrific for your spirits, and it's wonderful to be outside, and it's a wonderful hobby. But putting around and pulling out weeds is not really exercise. And so certainly you should do that. So what's the goal for exercise? So the National Institute of Health recommends 2.5 hours a week of designated time for exercise, which is 30 minutes 5 times a week of exercise. The intensity of exercise should be moderate. So what's moderate intensity? Moderate intensity is you can talk, but you're slightly breathless. You can't talk long sentences, but you can certainly talk. That's what moderate intensity is. So if you sort of having a gentle stroll and you're talking a breeze and you don't even notice you're walking, that's not moderate intensity. So to get the benefit of exercise, it's moderate intensity, 2.5 hours a week, 30 minutes 5 times a week. And it turns out that there are 4 types of exercises. There's endurance or cardiovascular fitness, strength, balance, and flexibility. And an exercise program needs to cover all of them. And so an exercise program over the lifespan is endurance or cardiovascular exercise for the first 50 years is very important. So what we usually associate with exercise, running or riding or swimming or cycling, would be anything that gets your heart rate up and you sweat and you're breathless, is very important for the first 50 years of your life. That controls your blood pressure, prevents cardiovascular disease, prevents diabetes, maintains your weight, controls high blood pressure, all the benefits of cardiovascular exercise. From 50 to 75, we need to start doing resistance exercises or strength exercises. Because what happens after approximately 50, sometimes a bit earlier, sometimes a bit later, we start losing muscle fibers. And loss of muscle fiber is called sarcopenia. Sarcopenia is the age-related association of loss of muscle fiber. And we can prevent that by resistance exercise, So weight training is very important. If you do an MRI of a 20-year-old across the thigh and count the number of muscle cells in a 20-year-old thigh, and then you go to an 80-year-old and count the number of muscles in an 80-year-old, the 80-year-old will have about 70% fewer muscle cells compared to a 20-year-old. And so it's not surprising that an 80-year-old will be much weaker than a 20-year-old. Part of the reason, or the majority of the reason, is that you have fewer muscle cells as you get older. You can actually prevent the muscle loss, the loss of the actual number of cells, by resistance exercises. So preventing sarcopenia by reducing the number of cells muscle cells that we all lose, is very important by resistance exercises. And for the final 25 years of your life, it's balance and flexibility. So, so what I tell people, if you're going to, so there are lots of healthy 80-year-olds, there are not that many healthy 90-year-olds. But if you get to be 90 and you haven't got Alzheimer's disease and you haven't had a stroke and you haven't had some terrible cancer and you haven't got Parkinson's disease and you have nothing bad happen to you, what's going to do you in is going to be balance and flexibility. Inevitably, you're going to lose your balance and you're going to start falling. And so for the last 25 years of your life, what you need to start working on is balance and flexibility, because that's where the disability. And Art Hister taught me this eponym BAF. You got a BAF: balance, aerobics, resistance, and flexibility. And so those are the components. And at different ages of your life, you need to do different things. So certainly flexibility and balance, the first and the last of BAF, are very important in octogenarians and non-octogenarians. But you certainly shouldn't neglect strength exercises to prevent sarcopenia. Just to make things interesting, it turns out, and I don't know if I have any slides on this, but in the last year, 18 months, there's a tremendous amount of research that says about Alzheimer's disease. And we now have biomarkers which actually can pretty accurately document the changes in the brain that occur during Alzheimer's disease. And so the biomarkers are the size of the hippocampus. The hippocampus is the part of the brain that's involved in memory. And we know that people, as they get older, the size of the hippocampus gets less. But if you have Alzheimer's disease, the hippocampus shrinks even more than normal aging. And surprisingly enough, you can bulk up your hippocampus by doing aerobic exercise. You can increase the size of your hippocampus by sweating on the treadmill or working up a good sweat. That doesn't necessarily mean that it stops Alzheimer's disease getting better, because these are early studies, but certainly your hippocampus will increase in size. What that means is not clear. Another piece of evidence, which is another piece of supporting evidence, you can do CSF biomarkers. So if you do a spinal tap and measure some proteins in the CSF, there are two that are currently very fashionable, called amyloid and tau, CSF amyloid and CSF tau. And what you want is a high amyloid and a low tau level. That's normal. With Alzheimer's disease, your amyloid levels drop and your tau levels go up. So that's a bad pattern. You can reverse that pattern to some extent if you exercise, aerobic exercise. That doesn't necessarily mean that the Alzheimer's disease is getting better or that you're getting smarter or aren't getting as demented, but it is an indication that something's happening in the brain. So there are two pieces of evidence to show that in dementia, aerobic exercise can, or in theory at least, provide some structural changes to the structural repair to the changes to the damage that's happening in Alzheimer's disease. So that's very, very exciting news. But what it does mean is that exercise is really the key. And we need to give our heads a good shake, and we need to really probably exercise harder than we thought that we were, and we need to do it consistently. And the challenge, of course, is what do you do when it's easy to exercise when you're 25 years old and you drive a car and you don't have any spinal stenosis and you don't get short of breath and et cetera, et cetera. It's much easier to exercise then. What do you do when you've lost your license because of macular degeneration and you have some back pain and your balance isn't that good and blah, 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 blah. Well, I totally understand that. The challenge then is to work closely with your doctor, with a physiotherapist, with the community center, with the case manager from Vancouver Coastal to develop an exercise program that's right for you. And then you've got to do it. You remember what I said about you can take a horse to water, but you can't make him exercise? It's fair. If you can facilitate exercises, but people have got to do the exercises. So the American Academy of Sports Medicine recommends taking a slow and stepwise approach that allows patients to reach attainable goals. 30 minutes or more of moderate intensive exercise 5 days a week, or 20 minutes or more vigorous activity 3 days a week. Vigorous activity should be rated 7-8 and should increase a large increase of heart rate. Moderate would be slightly breathless but able to speak. Vigorous is that you're breathless and only speak in short sentences, short words. And then flexibility and exercise, stretching after exercises. So I think you have to start low, go slow, have realistic goals, but I think motivation is key. Muscle strengthening exercise and balance include progressive weight training or weight-bearing calisthenics, 10 to 15 reps of moderate to high on 2 non-consecutive days. Balance initially taught, then continued as a home exercise program. So that's something which most of us can do if we're motivated enough. It doesn't matter what exercise you do, long as you reach your target. Even if sitting on a chair and vigorously raising and stamping your feet to get your heart rate up would count as exercise. If you have a spinal stenosis and you can get hold of a machine which allows you to row like that to get your heart rate up, that would work as well. So it doesn't really matter. There are lots of ways to be adaptable. So the best form of exercise that I've found in my practice are ballroom dancing. People who like ballroom dancing are colossally lucky because it combines absolutely everything. I had this patient who was 96 years old, and his daughter-in-law was a dietitian, and she asked me to see him because he was getting short of breath. And so I said, when did you get short of breath? He said, well, when he walks up the 3 flights of stairs to his dance class, which was in Chinatown, he gets short of breath. So he had aortic stenosis, and people know, but basically now you have this magic technique which Dr. Webb can put in replace the aortic valve with keyhole surgery and blah blah blah. So now he's back dancing, so everybody's happy. So obviously that's a great result. And so his family said, oh, that's wonderful, maybe I should see his wife. So I saw his wife, and his wife was 89, he's 97. And she was fine. She had some minimal cognitive impairment, and I asked her to get off the bed, and she just jumped off the bed and leaped off completely fluidly and just without any disability whatsoever, because she's been ballroom dancing with her husband for the last 50 years. And it turns out that, and so ballroom dancing is really good because it's incredibly social, and you go 3 or 4 times a week, and you have a group of people, and if you're a man, and you get lots of dates because there are more women than men, and so you get lots of dance partners, and it's very social. It's good aerobic exercise because you certainly get your heart rate. It does coordination and balance, so it really has the full 9 yards. It's really the full meal deal of exercise. So this is a 101-year-old who just bought a Camaro. Said, I always wanted a sports car, Virgil said, who was turning 102 in January. He met with Ed Welburn from General Motors. And so he told me, if I keep it for 10 or 12 years, it'll be worth about $100,000. He's very optimistic. And Mr. Kaufman said, once in a while I like to kick it up, but I'm afraid if I drive too fast and get a ticket, then they might take my license away. So that's a true story. So changes in lifestyle and medical care can prevent or significantly postpone age-related morbidity. And there are many clinical clues that help to predict successful versus unsuccessful aging. And this is my hero. So he said, Harold, as we get older, we sometimes begin to doubt our ability to make a difference in the world. It is at times like these that our hopes are boosted by the remarkable achievements of other seniors who have found the courage to take on the challenges that would make many of us wither. Harold Stromberg is such a man. What he said, I've often been asked, what do you do now that you're old and retired? He said, well, I'm fortunate to have been to have a chemical engineering background, And one of the great things I enjoy most is turning beer and wine into urine. He should be an inspiration to most of us. So thank you for your attention.